In order to educate stakeholders and Lagos residents about the advantages of equitable access to cost-effective healthcare services, the Lagos State Health Management Agency, LASHMA, has held its first health insurance summit at the Civic Center in Lagos. The State Governor Babajide Sanwo-Olu says the goal of health insurance is to create a functional, responsive and resilient healthcare system for Lagos residents. Our correspondent Sidney Okafor has more details in this next report.
At the unveiling of the Ilera Eco Virtual Boat, stakeholders and investors from both public and private health sectors gathered in this hall to discuss the ongoing difficulties facing health maintenance organizations (HMOs) in the state, in an effort to spotlight the disparities in healthcare quality in Lagos. The Lagos State Health Management Agency (LASHMA), established in 2015, oversees the Ilera Eco scheme in Lagos State, which aims to provide all Lagos residents with fair access to effective healthcare service while shading their finances from the cost of healthcare. The co-founder of Health System Consult Limited, Nkatachukwu, underlined how technology may improve healthcare system and the state's new Ilera Eco Virtual Boots program.
Sure that Lagosians who can pay are paying, because the fundamentals of health insurance or any kind of insurance is cross-subsidization. Those who are healthy, young, productive need to contribute to the pool so that those who are less healthy, less productive, you can equalize the risk and you're able to provide care to everybody. So for as long
stakeholders advise public-private partnership to be effective and transparent in order to satisfy the expectation of the state residents, as well as raise funds to support this program.
Of life. I am aware that since its establishment, LASHMA has been committed to ensuring that all residents of the state are registered on the scheme, which was rebranded in 2021 as Ilera Eco. Every resident of Lagos State should have access to quality care, especially small business owners, the informal sector, and vulnerable persons. In order to support these efforts of the agency and subsidize their premium, whereby government remits 75% of the premium and the staff pays 25% annually.
In Nigeria, only 3% of individuals between the ages of 15 and 49 have any type of health insurance coverage. According to 2018 Nigerian Demographic and Health Survey, health professionals say that the summit has demonstrated that the access to insured healthcare is not just for the elite, but also for the low-income earners in Lagos.
That we have done is that number one, we have one of the cheapest plans in Nigeria. Number two is that you have the latitude to pay installmentally instead of paying one-off. So because we are IT enabled, if you make your payments on a monthly basis, as long as you are making them, you can still access the same care that someone that paid, once will get. Also, as you heard, we've started the Eco-Social Health Alliance, which is an arm of LASHMA that is responsible for mobilizing funds to be able to look after those that cannot pay for themselves. That is something that we are expanding. Mr. Governor has made the Equity Fund now a first-line charge. We have the Basic Healthcare Provision Fund, and we have lots of private sector players and partners supporting us. So yes, the best is yet to come. Thank you.
Despite its many challenges, Lagos continues to top other states in the area of skilled birth assistance, infant vaccination, as well as contemporary family planning. Sidney Okafor, TV360 News, Lagos.